Hi everyone. A friend of mine asked me how I remember the diastolic dysfunction criteria, and so here's my memory aid for it. I kind of remember all of the numbers in the criteria, and so this is for patients with normal LVEF. I'll make another video on patients with depressed LVEF or in patients who you suspect have diastolic dysfunction. But the way I remember the numbers is I think of the seven times table, right? You have 7 times 1 equals 7, 7 times 2 equals 14, 7 times 3 equals 21, 4 equals 28, and 7 times 5 equals 35. And so 7 times 1 equals 7 helps me remember that it's the septal E prime velocity. And if the septal E prime velocity is less than 7 centimeters per second, that's one of the criteria. 7 times 2 is 14. So 14 helps me remember that if the E over E prime is greater than 14, that ratio, that's one of the criteria. 7 times 3 is 21 is not there. 7 times 4 equals 28. So that helps me remember that if the TR velocity is greater than 2.8 meters per second, that's one of the criterias. And then 7 times 5 equals 35. It's not exactly 35, it's close to 35. So the LVE or the LA volume index greater than 34 milliliter per meter square. If it's greater than 34, that's one of the criterias. um, the way I remember that septal has to be less than 7 is that we both start with the letter S. So septal less than 7, the E prime. And then the lateral 10, I kind of just remember it, but the L looks like a 1, so that's how I remember 10, but I don't know if that helps. So anyway, in patients who have just one criteria positive out of these, they have normal diastolic function. If there's two, so it's 50%, so it's indeterminate. And then if they have three or four positive out of these, then they have diastolic dysfunction. Um, and then and then learning this is actually more of just repetition. Like you keep applying this to all of your patients. Whenever you come across a patient, you think about all of the criteria. And with repetition, actually sometimes you don't even require the mnemonic. You kind of just memorize the numbers because you do it so many times that it just becomes like a photographic memory almost. Another thing that confused me a lot was, is it greater than or less than? So all of the criteria is greater than. So if it's A over E prime is greater than 14, TR velocity greater than 2.8, and LA volume index greater than 34 milliliter per meter second per meter square. And then the E prime velocity is actually a tissue Doppler parameter, correct? So that's how much your myocardium contracts. So it's like a marker of contractility. Or so you want the myocardium to be vigorous in the contraction and relaxation, right? So and that's how you think of athlete's heart as well, because they will have a vigorous contraction and relaxation pattern, and so their E prime velocities will be high, and that's what you expect in normal hearts. So if you have someone with LV hypertrophy and they have septal E prime less than 7 or lateral E prime less than 10, then that makes you think of diastolic dysfunction. Maybe it's not athlete's heart, maybe you're dealing with something like HCM. So that helps me remember that it's the E prime velocities is if it's less than the number, that's one of the criteria for diastolic dysfunction. Hope this helps. Stay awesome.